Pick that up, sweetheart. That is what Dr. Caldwell said 48 minutes before a Navy SEAL commander arrived bleeding out on his operating table. St. Michael's Hospital in Savannah smells like bleach and burned coffee at 5 in the morning. Katie Morrison moves through the pre-dawn surgical wing with quiet efficiency, her hand steady as she preps instrument trays under flickering fluorescent lights that hum with the constancy of machines that never rest. She's been here 3 weeks, a civilian nurse, unremarkable except for the faint scars on her forearms she keeps covered with long sleeves. The scars are thin, precise, the kind that come from shrapnel and field medicine, not from anything she can explain to hospital credentialing. In her locker, wrapped in cloth the color of old canvas, sits a tarnished military challenge coin. She touches it once each morning before her shift, the metal worn smooth by 18 years of hands that had held lives together. The coin bears an insignia most civilians wouldn't recognize, the unit insignia from a field hospital in Kandahar where she'd once saved 14 people in a single night. Her fingers linger on it for exactly 3 seconds. Then she tucks it into her scrub pocket, where it will stay until this shift ends. During equipment inventory, she organizes a crash cart with precision that seems unnecessary for routine work. Katie checks each drawer twice. The airway kit. The chest tubes. The scalpel tray positioned at a specific angle for fastest access. The epinephrine drawn up to 1 mg in a 10 ml syringe. A nurse from day shift watches her work, eyebrows raised, you prep like you're expecting a war zone. Katie's jaw tightens imperceptibly. Her voice stays flat, measured, the voice of someone who has learned that anger given volume becomes complaint. Just thorough. She is thorough because she cannot afford not to be. She is thorough because the NCIS investigators who placed her here 3 weeks ago had been very specific. Her cover as a civilian nurse needed to hold for exactly 8 weeks while she documented fraudulent military billing contracts being processed through St. Michael's Accounts Receivable Department. $847,000 in unauthorized charges to the Department of Defense. 2 contract reviewers with names that appeared nowhere in the hospital directory but everywhere in the financial records. And Dr. Caldwell's signature on 14 invoices that shouldn't exist. Her true rank, a Master Chief Petty Officer, was buried in a classified file locked in a Pentagon safe she would never see again. Her name, her service record, her 3 combat deployments and the Navy Cross folded in a drawer at her apartment, all of it was gone now, replaced by a social security number that didn't exist 6 months ago and a nursing credential that was real but incomplete. She had everything she needed to do this job. Everything except the ability to explain why she knew how to tie off a bleeding femoral artery or perform emergency cardiac massage in a field environment with no monitors and no time. Through the staff lounge window, she watches Dr. Caldwell's BMW pull into his reserved spot at 6:02 a.m., right on schedule. The car is the color of money. His briefcase probably cost more than Katie made in a month. Her hand moves unconsciously to the coin in her scrub pocket. He had no idea that the woman he was about to humiliate held a rank higher than anyone in this building. He had no idea that she had spent 18 years answering when people shouted her name because they were dying. Dr. Caldwell walks into the hospital like he owns it. His shoes are polished. His tie is silk, the kind that catches light. He nods at the morning security guard, who knows better than to nod back. Katie watches him from the hallway near the imaging suite, staying in the periphery where she has learned to position herself. Make yourself smaller. Make yourself forgettable. Make yourself invisible to men like this. Morning surgical rounds begin at 7. Katie stands in the corner of the conference room with the other 3 nurses assigned to the day shift. Dr. Caldwell sits at the head of the table, flanked by 2 attending physicians and a resident who looks like he hasn't slept in 4 days. There are 12 cases on the schedule. 7 of them will require Katie's direct assistance. She listens with the focused attention of someone accustomed to processing medical information under fire. Dr. Caldwell shuffles through patient files with one hand while the other holds a coffee mug that says "Don't ask me before 7 a.m." in clinical blue letters. He gets to the staffing announcement, and Katie feels the moment shift. The air pressure changes. His eyes find her in the corner, and something in his expression hardens into satisfaction. "I have a new bet going with the attending physicians," he says, not taking his eyes off her. $25 from each of them. "I'm betting this one," he gestures toward Katie with his pen, "quits within the week." She has the look of someone who didn't do her homework before taking a job. Soft. Out of her depth. One of the attending physicians clears his throat. The resident suddenly becomes very interested in his clipboard. Katie feels the attention of the other two nurses shift toward her like searchlights. She does not feel her face warm. She does not clench her teeth. She has learned that her composure is her power, that the trembling is not fear but restraint, and that men like Caldwell mistake silence for weakness because they have never trained in it. The case load for today is moderate, Caldwell continues, as if he hasn't just announced to a room full of people that he expects her to fail. "Don't screw it up." He stands, straightens his tie, a gesture designed to be observed, and walks toward the door. The rounds conclude without any of the physicians making eye contact with Katie. This is the choreography of institutional bullying. The steps are learned. The music is predictable. By noon, Katie is running on 5 hours of sleep and the contents of a protein bar she grabbed between the 7:30 appendectomy and the 9:15 gastric bypass. The caffeine from the burned coffee tastes like copper. She stands in the hospital cafeteria with a tray holding a salad, a roll, and a bottle of water, practical food, the kind that doesn't require full attention to consume. Around her, orderlies and dietary staff and visiting family members navigate the line with the particular exhaustion of people for whom noon is the end of a shift rather than the middle of one. Dr. Caldwell appears behind her in line. Katie doesn't see him approach, but she feels his presence the way animals feel pressure changes before a storm. He is carrying his own tray. He is smiling in the way that men smile before they do something they find amusing. "I'm surprised you made it this far," he says to the back of her head. "Usually they last until Tuesday." Katie turns to face him. Her hands remain on her tray. "I'm planning to last longer, Dr. Caldwell." It is the wrong thing to say. Not because it is disrespectful, but because it suggests that she intends to stay, that she has made a decision to be here, and Caldwell's entire purpose is predicated on breaking the will of people he perceives as underneath him. He sets his tray down on the adjacent counter with deliberate slowness. Then he knocks Katie's tray onto the floor. The salad spills across the tile in a green arc. The roll bounces twice. The water bottle cracks but doesn't break, leaking across her shoes and the hem of her scrubs. The sound of the crash silences the cafeteria for exactly 2 seconds. Then conversation resumes. Nobody helped. Nobody was going to help. Caldwell picks up a patient chart from a nearby table. It belongs to another patient, another room, one of the surgical cases scheduled for after lunch, and tosses it at her feet with a smile that is meant to be observed. "Pick that up, sweetheart." Katie retrieves the chart with steady hands. She wipes her wet scrubs with a paper towel from the dispenser. She cleans the salad from the floor, the roll, the plastic water bottle. She does all of this while Caldwell watches, waiting for the moment when her composure cracks, when her eyes fill with tears, when she says something insubordinate that he can use to justify firing her before she becomes an actual problem. She does not give him that moment. When the floor is clean and the tray is disposed of and the chart has been returned to the correct room, Katie walks back to the surgical wing. Her scrubs are damp. Her shoes squeak slightly with each step. Behind her, she hears Caldwell laughing with one of the orderlies, a laugh that is meant to be heard, that is designed to advertise what he has done and the fact that nobody will face consequences for it. The afternoon shift passes in silence. Katie assists on 3 surgeries. She preps rooms. She documents vitals. She moves through her work with the kind of precision that suggests she is not thinking about the cafeteria, not thinking about the tray, not thinking about the humiliation that Caldwell has just broadcast to 30 people who work in this hospital and see each other 5 days a week. But what Caldwell doesn't know is that she is also cataloging. She is also paying attention. She is also uploading photographs of invoices to an encrypted server every time she takes a bathroom break. She is also the reason that the federal government is aware of $847,000 in fraudulent contracts, the reason that NCIS is building a case that will take down not just Caldwell but the 2 contract reviewers and possibly a board member whose name appears on invoices dated 3 years before he officially joined the hospital administration. She is also a Master Chief Petty Officer who has spent 18 years doing harder things than picking up a tray while people watched. She is also someone who once held a man's heart in her hands in a field hospital in Kandahar while a medic ran for blood. She is also someone who does not tremble when challenged. At 5 p.m., she clocks out and walks to her car, a 2008 Honda Civic that was deliberately selected to be forgettable. She sits in the driver's seat without starting the engine. Her scrubs are still damp. Her shoes are still wet. The coin in her pocket feels heavier than it should, the way objects feel heavier when they carry weight beyond their physical form. She reaches into her pocket and touches it once. 18 years. 3 tours. 14 lives saved in Kandahar. 1 Master Chief Petty Officer sitting in a parking lot in Savannah, waiting for the moment when everything she has sacrificed becomes visible. The first Navy SEAL commander would arrive in 48 hours. He would bleed on Caldwell's operating table. And Katie Morrison, the quiet nurse in the corner, would have exactly 6 minutes to decide whether she wanted to stay invisible or whether the time had finally come to break her cover. But that wasn't what happened next. 3 days after the tray incident, a medical evac arrived by ambulance, routine appendectomy, former Army combat medic named Jacob Chen, 34 years old, vital stable. Katie didn't recognize his name on the admit board. Nothing in his chart connected him to classified operations, nothing that suggested he would become the thread that nearly unraveled everything. She prepped the OR while Dr. Caldwell reviewed imaging in the adjacent room, his voice drifting through the intercom with the casual arrogance of a man who'd never been questioned. The surgical nurses, 3 of them, all friendly, all careful to distance themselves from Katie after watching Caldwell humiliate her at lunch, moved through their checklist with practiced efficiency. Katie positioned the instrument tray, her movements economical, each tool placed exactly where her hands would find it without looking. The incision opened clean. Caldwell's suturing technique was competent, methodical, the kind of surgery that would be in every textbook as a teaching example of adequate work. He didn't excel. He simply never failed. That was the source of his institutional power, not brilliance, but consistency. The hospital administration trusted him because he'd never given them reason to doubt. They didn't know about the phantom procedures, the duplicate billings, the patterns Katie had photographed on 17 different nights. They only saw a surgeon who made money and kept patients alive. But then Caldwell stepped back from the table, and Katie moved in to begin closure. The appendix was out, the site irrigated, and now came the suturing, the part that separated adequate work from exceptional work. Katie's hands moved into the surgical field with the kind of precision that came from muscle memory, the kind of precision that came from doing this thousands of times, but not thousands of times in Savannah. Thousands of times in a forward operating base outside Kandahar. Her first suture was a 4-0 absorbable, tied with the surgical knot, double throw, then a locking stitch that pulled the peritoneum closed with tension that was perfect, not so tight it would cause tissue necrosis, not so loose it would gap and bleed. Her hands moved faster than Caldwell's. Her knots were smaller, tighter, more efficient. Each stitch was placed with a rhythm that came from practice under pressure, the kind of pressure where a loose knot meant a patient bleeding out in a tent when the next medevac wasn't due for 8 hours. The surgical nurses exchanged glances. One of them, the woman named Sarah who'd been professionally polite to Katie for exactly 2 minutes after Caldwell's public humiliation, actually leaned forward to watch. The attending resident scrubbed in at the far end of the table did the same. Katie didn't acknowledge the attention. She kept working, her focus absolute, her movements executing the closure with a precision that was, in that moment, undeniable. The suturing took 14 minutes. When she was done, the closure was flawless. Caldwell didn't comment, which was the kind of silence that meant more than criticism. The surgical nurse's expressions had shifted from polite distance to something that looked almost like respect. Katie stripped her gloves and stepped back, already preparing the next phase of closure, her face a mask of professional calm. Jacob Chen was awake in recovery when Katie did her first post-operative vitals check. His morphine drip was running smooth, his heart rate elevated but normalizing, his oxygen saturation holding at 98%. He tracked her movements with the kind of awareness that suggested the anesthesia was wearing faster than expected. Katie checked his dressing, her touch clinical and efficient, noting the absence of fluid seepage and the appropriate capillary refill at the wound edges. "You're doing fine," she said quietly. "Rest. The pain medication will keep you comfortable." His hand moved, his fingers closing around her wrist with surprising strength for a man still half sedated. His eyes were blue-gray, the color of cold steel, and they were looking directly into hers with an intensity that made her entire nervous system go rigid. "You tied off bleeders in Kandahar, didn't you?" His voice was slurred but deliberate, each word separated by the thickness of morphine but spoken with absolute certainty. "I know field medicine when I see it. I've seen it before. I've done it before." The recovery room suddenly felt very small. One of the nurses was at the opposite end, updating a chart, her attention elsewhere. But the observation would spread. That was how hospitals worked. Information moved through the corridors like water through cracks in concrete. Katie's first instinct was to pull away. Her second instinct was to lie. But Jacob's grip didn't loosen, and his eyes didn't waver, and in that moment she understood that he wasn't accusing her of something. He was recognizing her. "You're still sedated," Katie said, keeping her voice at the same even pitch she used with all post-operative patients. "The morphine causes disorientation. Rest." She gently removed his hand from her wrist, her movement deliberate but not forceful. "That's an order." "Who are you?" His eyes were already closing, the medication pulling him back down toward unconsciousness, but the question hung in the air between them like cordite smoke. Katie didn't answer. She adjusted his for flow, checked his oxygen saturation one more time, and walked away before he could say anything else. Her hands didn't shake. Her breathing remained steady. But her tactical assessment of the situation had just escalated from manageable to complex. She needed that conversation to stay between them. She needed Jacob Chen to attribute his observation to the after-effects of general anesthesia. She needed the fact that she'd closed an appendectomy with the precision of someone who'd done emergency surgery under fire to be explained away by competence alone, by training, by natural talent, by nothing that connected to NCIS or classified assignments or the reason she'd been placed at St. Michael's in the first place. The problem was that Jacob Chen wasn't the kind of man who forgot things. Combat medics developed pattern recognition because pattern recognition kept them alive. He'd seen her hands work the sutures. He'd recognized the technique. And in a few hours, when the morphine cleared completely, he'd remember the conversation and he'd start asking questions. The security guard named Marcus was standing near the nurse's station when Katie emerged from the recovery room. He was a quiet man, maybe 50, with a kind of posture that suggested military background, shoulders set, spine straight, the way you stood when you'd been trained to stand. He wasn't technically part of the hospital security team that answered to Caldwell's ally on the administrative side. He was something older, something that reported to a different structure entirely. Katie had noticed him during her first week, the way he seemed to be everywhere, the way his eyes tracked movement, the way he never spoke unless there was a reason. As she passed him, his expression shifted. Not dramatically. Just a slight widening of the eyes, a minute adjustment in the set of his jaw. He'd heard something, either Jacob's words or someone passing along what Jacob had said. And he was processing information, running calculations, reassessing whatever file he maintained on the quiet nurse from the NCIS placement. Katie kept walking without acknowledging him. But her mind was already 3 moves ahead. If Marcus reported to the same handler who'd placed her at St. Michael's, then she'd just become a loose end in her own operation. If he reported to someone else, she was in a different kind of danger entirely. She had approximately 48 hours before Caldwell made his next move, and she had no idea what that move would be. But the evidence she'd gathered, the billing fraud, the phantom procedures, the names of the 3 board members who'd approved the invoices, all of it was still photographed and hidden, still accessible but still unreachable while she was locked in this place maintaining her cover. The emergency alert system crackled to life at precisely 6:27 p.m. All personnel, stand by. Medical evac inbound. ETA 12 minutes. Trauma team to ER. Stand by. Katie's hands went completely still. She was charting at the nurse's station, documenting Jacob Chen's recovery vitals, and her hand simply stopped moving in the middle of a sentence. The dispatcher's voice came through again, louder now. Commander, Navy SEAL, medical evac from Bagram. Shrapnel wound to femoral artery. Hemorrhage control attempted in field. Patient critical. Stand by for resuscitation protocol. The floor suddenly felt like it was tilting, like gravity had shifted 0.5 degrees. Bagram. A Navy SEAL commander with a femoral artery wound from Bagram. Her briefing materials, the classified folder that had been placed in her hands 3 weeks ago during her final NCIS briefing before undercover deployment, had mentioned exactly one name, a Navy SEAL commander whose medical records would expose the entire billing fraud network at St. Michael's. He was supposed to arrive for treatment in October. It was July. Katie stood, her movements precise and controlled, and began walking toward the ER without being called. Her heart rate had elevated to approximately 102 beats per minute, but her breathing remained steady. Her hands were cold, not from fear, but from the tactical calculation already running in her brain like code executing in parallel. If he dies, the evidence dies. If he survives, and if Caldwell is involved in his care, then his treatment records will either reveal the fraud or will be falsified to cover it. She was walking directly toward the moment where her cover would break or her mission would complete. Behind her, Marcus watched from the nurse's station, his expression unreadable, his phone already in his hand. The rotor wash hit the hospital entrance like a physical force, shaking the glass doors and scattering paperwork across the intake desk. The medevac bird banked hard over Savannah, its nose tilting down as it approached the landing pad on the roof. Katie heard the alarm before she saw the stretcher, a code red tone that sent every available trauma surgeon sprinting toward the elevator banks. She was restocking the suture cart in Trauma Bay for when Caldwell's voice crackled over the intercom, incoming. Military priority. 23-year-old male, GSW equivalent, femoral arterial wound, ETA 3 minutes. Her hand stopped. GSW equivalent meant shrapnel, meant Bagram or Kandahar, meant someone's kid was bleeding out at 30,000 feet and the only thing between his chest and the sky was a combat medic with a pressure bandage and prayer. The stretcher arrived like a hurricane. For paramedics moved in surgical synchronization, calling vitals in the clipped language of men who'd done this 1,000 times in sand and blood and chaos. BP 98/62, dropping. Heart rate 128. O2 sat 84 on high flow. Femoral entry wound, anterior thigh, shrapnel burst pattern, estimated blood loss 2 liters pre-hospital, compression bandage holding but not stable. The commander's uniform had been cut away in strips, revealing a chest that rose and fell with terrified shallowness, and his left thigh was wrapped in compression bandages that were already seeping dark red at the edges. His eyes were open. That was the worst part. He was awake and he knew. The paramedic's voice cracked slightly, his combat search and rescue qualified. Unit says he went down during a landing zone clear. Took shrapnel from a Taliban IED. Medevac was 15 minutes. He's been hemorrhaging the whole flight. Caldwell swept into the trauma bay like a man entering his cathedral, his scrubs pristine, his expression already carrying the weight of someone about to save a life. He clapped once, sharp as a gunshot. All right, people. Let's move him to the table. I want 2 large ball lines in the arms, type O negative, uncross-matched, push it fast. Get me a surgical kit, stat. We're going to need a rapid infuser and every unit in the blood bank. His voice carried the absolute authority of a man who had saved lives before, who knew exactly what needed to happen. Katie watched him from her position at the equipment rack, noting how he moved, smooth, confident, in control. The trauma team responded like an orchestra, each person sliding into their role without hesitation. The commander was on the table in 18 seconds. The compression bandage came away. The wound underneath was a ragged entry point, maybe 2 inches across, with subcutaneous hemorrhage spreading like a wine stain across his upper thigh. Caldwell leaned in, his face inches from the injury, probing with gloved fingers while the trauma nurses hung blood on the rapid infuser. "Okay. I see the entry point. The shrapnel trajectory looks relatively clean, anterior lateral approach." He straightened up, pulling a fresh pair of gloves. "We're going to control this hemorrhage manually first, then move to primary repair. Get me the surgical kit. Now." Katie's stomach did something strange. Her eyes traced the wound's edges, the pattern of the bleeding, the exact angle at which the blood was flowing. Muscle memory. Kandahar. Field hospital tent during a mortar strike, a 21-year-old Marine with an identical wound, and her hands knowing exactly where the real bleeder was hiding underneath the deceptive entry point. She said, very quietly, "Doctor, the trajectory suggests posterior involvement. You're looking at the entry wound, but the shrapnel likely continued deeper. Possibly into the..." Caldwell's hand came up like a stop sign. "I didn't ask for your assessment, sweetheart." Clamp. His eyes didn't even move. She was erased. The trauma team worked. Caldwell began suturing the visible wound with the methodical precision of a man who had done this procedure 100 times, maybe more. The stitches were clean, professional, textbook. But the bleeding didn't stop. It slowed for a moment, then continued, the red seeping through each layer of sutures as fast as he could tie them. Katie watched the monitor. The commander's blood pressure was falling like a stone down a well. 95. 90. 85. She said nothing. She had been told not to speak. Caldwell's forehead was beginning to bead with sweat. He abandoned the sutures and moved to cauterization, using electrical current to burn the bleeding vessel shut. The smell of charred tissue filled the trauma bay, acrid and wrong. Katie's jaw clenched. That wouldn't work. That had never worked with posterior bleeds. The vessel he was cauterizing was a branch, not the main artery. The real bleeder was deeper. It was always deeper. Caldwell stepped back from the table, wiping his forehead with the back of his hand, and for one instant she saw something flicker across his face, not panic, but the first cousin of it. Concern. Doubt. The commander's BP hit 70/40. The monitor alarm shifted to a higher pitch, an escalating wail that made everyone in the room move faster. Caldwell leaned back in, his confident movements becoming more aggressive, more desperate. He called for packing material, sterile gauze that he began shoving into the wound, layer after layer, trying to create pressure and clotting. The gauze saturated almost immediately, blood weeping through it like water through paper. The commander's eyes had gone unfocused now, shock setting in, his chest barely moving. Katie felt her hands moving without permission. She stepped forward. "Doctor, if we access through the anterior medial approach and mobilize the sartorius," Caldwell's voice cut through the room like a blade. "Quiet. Step away, Nurse Morrison. Now." She stepped away. The trauma bay fell silent except for the machines. The monitors screamed their electronic warnings. The rapid infuser pumped blood into the commander's veins as fast as a human heart could receive it, and his pressure continued to fall anyway. 55/30. The pale grey tone of massive exsanguination was creeping up his neck. Caldwell had moved from aggressive to something else now, a methodical attempt to control damage, his movement slowing, his jaw tightening. He knew. Katie could see it in the way his shoulders had settled, the way his breathing had changed. He was going through the motions of saving this man because there was nothing else to do, but he was already writing the ending. 40/0. The diastolic pressure had simply vanished. Katie watched the monitor with the cold clarity that came from having stood in this exact spot before, in a tent in Helmand Province with no morphine and 2 hours until the next medevac bird. The commander's pulse was failing. His body was telling his heart to give up. Caldwell stepped back from the table. His hand went to the cardiac monitor. His voice, when it came, was heavy with the weight of professional failure. "Asystole. He's been down for 2 minutes. No response to resuscitation attempts. No electrical activity. He paused. His eyes scanned the room, settling on his trauma nurses, on the machines, on the commander's pale face. Call it. Time of. No. Katie's voice wasn't loud. It didn't need to be. It cut through the room like cold water through warm glass, stopping everyone mid-movement. He's still viable. We can access through the anterior medial approach, mobilize the sartorius, get direct visualization of the femoral artery. 2 minutes. That's all I need. The silence lasted exactly 3 seconds. Caldwell's head turned toward her with the slow precision of a man who had been insulted. His face was red now, not pale, not confused, red. The kind of red that came from someone's authority being questioned in public, in front of his team, in front of a trauma bay full of people who had just watched him fail. Nurse Morrison, he said, each word careful and controlled, step away from the table. This patient is gone. I have called it. Your shift is over. He turned toward the trauma bay door, and that's when Katie saw it. His hand was already moving to his pocket, to his phone. His eyes were searching the hallway beyond the trauma room window, and even from her position at the equipment rack, she could see them arriving. 2 men in suits, moving with the purposeful stride of people who had been summoned. They were the same men from the billing invoices she'd been documenting for the past 3 weeks. The same names on the fraudulent contracts. Caldwell was texting them right now. He was calling them to remove her. She had maybe 30 seconds before security arrived, before the opportunity collapsed, before Caldwell had her physically escorted out of this hospital and her NCIS assignment evaporated like smoke. The commander's monitor flatlined. A single tone, sustained and accusatory. Alive or dead, she had one choice. Lock the door. Blow her cover. Save the life of a man from her own command structure, knowing that everything else, the investigation, the evidence, the mission that had brought her to Savannah in the first place, would burn to ash. Or walk away. Let the commander die. Keep her cover intact. Complete nothing. She moved toward the door. The trauma room door locked with a click that sounded like a rifle bolt sliding home. Katie's hand was already on the handle, already turning it, and Caldwell reached for her arm with his mouth open, confusion rippling across his face like a stone hitting water. What the hell do you think you're? But she was moving. Already moving. The scalpel came from the crash cart in one fluid motion, the blade catching the overhead lights as she positioned it at the second intercostal space, mid-clavicular line. The commander's chest rose and fell in the rhythm of the ventilator, his pressure dropping in real time on the monitor, 60, 55, 52, the numbers falling like a countdown to nothing. Nurse Morrison, open this door immediately. Caldwell pounded on the glass partition. His voice had the tone of a man accustomed to immediate compliance, accustomed to dominance, accustomed to rooms that bent to his will. This room was about to teach him something different. Katie made the first cut with the precision of someone who had done this in darkness, in dust storms, with mortar fire shaking the walls of a forward operating base. The scalpel moved through tissue like a surgeon conducting a symphony, deliberate, controlled, each movement exactly where it needed to be. The respiratory therapist stood frozen, watching her hands work. Where did you learn? But Katie didn't answer. Answers required time. Answers required breath. The commander required blood flow. The second cut. The third. The chest cavity opened like a book, and Katie's hands moved into it without hesitation, without the tremor that should have been there. Her fingers found the left ventricle, felt the wall of the heart beneath her palm, and began direct cardiac massage with the kind of rhythm that comes from muscle memory forged in places whose names don't appear on maps. Her other hand reached across the open field, fingers finding the femoral artery, locating the exact point where the shrapnel had torn through tissue, and she applied pressure with her thumb, steady, controlled, perfect. Blood pressure climbing. 60, 70, 80. The monitor's beat became a rhythm again, became music, became proof that time wasn't running out anymore. Get me O negative. For units. And prep the rapid transfuser. Her voice had changed. Not loud, but the kind of quiet that moves mountains. The respiratory therapist snapped to motion like someone had switched him on. He ran. Katie maintained her compression angle, her other hand steady on the artery, her entire body a piece of surgical equipment functioning at maximum efficiency. Through the trauma room window, she could see Caldwell with security now. 2 security officers, their uniforms dark and purposeful. And beside them, the 2 board members. She recognized their faces from the invoices. Their names had appeared on every fraudulent contract in her investigation. They'd been stealing from the military for 3 years. They'd been walking through this hospital like men who owned it because, in a sense, they did. They owned the administration. They owned the contracts. They owned the silence that covered everything. Caldwell's mouth was moving, pointing at her through the glass. The administrator was already there, already holding a folder. Even from across the room, even with her hands inside a man's chest, even with her focus narrowed to the width of a cardiac rhythm, Katie understood what was happening. They weren't calling the Board of Medicine. They were protecting themselves. They were erasing her. His stable. Katie checked the surgical field one final time. The bleeding was controlled. The heart was beating, not on its own yet, but beating. She withdrew her hand slowly, met the commander's eyes for exactly 1 second, and saw recognition there. He knew. Somehow, he knew. Get him to ICU. Continue compressions. Her voice carried the weight of command, of authority, of a woman who had survived things that would have broken men half her size. The respiratory therapist moved without question. The surgical nurse moved without question. They moved because her voice was the kind that got obeyed. The trauma room door burst open. Security came through like water through a broken dam, their hands already reaching, their faces already set in the expression of men following orders from above. Caldwell was screaming, actually screaming, about unauthorized procedures, insubordination, reckless endangerment. His voice had lost its control. It had the pitch of a man watching his carefully constructed world disintegrate. The administrator held the termination paperwork like a weapon. You're terminated, effective immediately. Surrender your badge. His words came fast, staccato, already practicing the justifications he would give the other board members later. Insubordination. Unauthorized procedures. Operating outside her scope of practice. Every word was rehearsed, already lawyered, already airtight. They marched her through the corridors still in her bloody scrubs. Her hands left red marks on nothing because she had been a Marine for 18 years, had been a corpsman for 12 of those, and had learned a very long time ago not to touch things carelessly. The staff locker room was empty when they arrived. She hung up her badge with the same precision she'd used on the commander's artery, each movement deliberate, controlled, showing absolutely nothing. Security left. The administrator left. Caldwell didn't have the stomach to watch. Katie stood alone in the fluorescent light, peeling off the blood-stained scrubs that had identified her as something simple, something disposable, something that could be fired by memo and terminated by fear. She folded them carefully. The scrubs became a rectangle. The rectangle went into the laundry cart. Another casualty. Another ending. Her phone buzzed 6 times in rapid succession. 6 missed calls from her NCIS handler. The secure line that was supposed to keep her connected to the mission, to the investigation, to the reason she'd spent 3 weeks eating lunch alone in a hospital cafeteria while a surgeon knocked her tray onto the floor. The investigation was over now. Not successful. Terminated. Her target had protected himself by destroying the messenger. The evidence was unreachable. The board members were untouched. Caldwell had called in his allies before she could secure anything, and now the one piece of leverage she had, the commander's survival, the proof of her competence, was locked in an ICU bed, and she was locked out of the hospital with a termination letter that would follow her through every employment background check for years to come. Katie walked to her car without looking back. The morning sun was climbing over Savannah, painting everything in colors that didn't match how empty she felt. The mission was burned. The cover was blown. She had saved the life of a Navy SEAL commander, and in doing so, she had destroyed everything she'd been sent here to accomplish. She didn't know that the hospital television in the waiting room was about to show her photograph. She didn't know that her identity was about to become the most important secret in St. Michael's. She didn't know that security guards who had served under her in Iraq were about to step forward. She didn't know that a two-star admiral was about to walk through the main entrance flanked by NCIS agents in tactical gear, that the commander was about to appear in the lobby holding a tarnished challenge coin, that everything she thought was lost was about to be found. The quietest person in the room might be holding it all together. The television screen in the St. Michael's lobby flickered to life at 7:43 a.m., and the morning news anchor's voice cut through the waiting room like a surgical scalpel. Katie Morrison's photograph filled the screen, not the headshot from her civilian nursing credentials, but her official Navy portrait in dress whites, shoulders back, eyes steady as a compass. The headline scrolled beneath her face, "Decorated Master Chief Petty Officer Missing After Undercover Investigation." The waiting room went absolutely still. A child stopped coloring. A visitor's coffee cup froze halfway to his lips. The anchor continued, "Master Chief Katie Morrison, a highly decorated naval officer, disappeared from civilian life 3 weeks ago to undertake classified NCIS investigation into military contract fraud at St. Michael's Hospital in Savannah, Georgia. Her service record includes 3 combat deployments to Afghanistan, where she served with distinction in tactical medicine roles. She was awarded the Navy Cross for Valor during a single night in Kandahar in which the screen cut to classified redactions. Then her ribbons filled the frame, Bronze Star, Silver Star, 2 Purple Hearts stacked like trophies, and above them, the Navy Cross itself. Nobody in that waiting room knew that the quiet nurse who'd been working nights for 3 weeks had been holding a secret that heavy. The hospital intercom system crackled. Someone, a voice with the authority of the federal government, had patched the lobby audio through every speaker in the building. Dr. Richard Caldwell heard his own name echo through the corridors, and despite Master Chief Morrison's attempts to provide emergency care, Dr. Richard Caldwell ordered her removal from the trauma bay, resulting in her termination under false pretenses while she was actively performing life-saving procedures on a Navy SEAL commander. Caldwell froze in his office on the 3rd floor. The file on his desk, the one marked insubordination that he'd already submitted to human resources, suddenly felt like a live grenade in his hands. He ran. His shoes pounded the stairwell, step, 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 down 4 flights, through the 2nd floor hallway, past the pharmacy, toward the lobby. His heart was doing something irregular. His breath came short. He had 3 minutes. Maybe less. The lobby doors burst open and Caldwell stopped dead. The 2-star admiral stood in dress blues, his presence making the air pressure change, the kind of authority that didn't need to raise its voice because everyone was already listening. Behind him, 2 NCIS agents in tactical gear flanked a third, who was reading from a tablet. The board members Katie had been investigating, the ones whose names had appeared on falsified VA invoices for $2.3 million in phantom services, were already in handcuffs, being led toward the exit by uniformed federal police. News cameras had materialized outside the glass doors like sharks sensing blood. The photographer's flashes made everything strobe and fractured. The admiral turned slowly, deliberately, as if he'd been waiting for Caldwell to arrive. "Dr. Caldwell," the admiral said. His voice was soft. That was worse than shouting. "You fired a Master Chief Petty Officer for saving a patient's life. You removed her from the trauma bay while she was performing life-saving procedures on a Navy SEAL commander under your command." Caldwell's mouth opened. Nothing came out. The cameras turned toward him. He saw himself reflected in their lenses, rumpled scrubs, day-old stubble, the expression of a man who'd just realized the rules had changed and nobody had told him. "You also conspired with these board members to defraud the Veterans Administration through falsified billing records," the admiral continued. Each word was a hammer strike. "The investigation Master Chief Morrison was conducting, which you attempted to terminate by firing her, has provided sufficient evidence for federal prosecution under the False Claims Act. Maximum penalty, treble damages and criminal liability. The hospital administrator appeared from the administrative wing, flanked by 3 attorneys whose expressions suggested they'd already written Caldwell's career into a history book titled Examples of Poor Judgment. The administrator stepped forward. "Dr. Caldwell, your employment with St. Michael's is terminated effective immediately. Your medical license is suspended pending investigation by the South Carolina Medical Board. You are to surrender your badge and credentials now. You are not permitted to enter this facility again without written authorization from federal prosecutors." The words didn't sound real. They sounded like they were happening to someone else, someone Caldwell was watching on a screen in another room. He looked down at his hands. They were shaking. That was new. His hands never shook. His hands were steady in surgery, steady in crisis, steady while firing a decorated officer for trying to save a dying commander. But right now, watching the NCIS agents leading the board members through the lobby in handcuffs, watching the news cameras capturing every frame, watching the staff of St. Michael's appearing in doorways with expressions ranging from shock to something darker, watching a security guard in a blue uniform step forward with his hand extended, those hands shook. Marcus. The man who'd worked security for 3 weeks while Caldwell had made jokes about him being washed up, the ex-Marine in the cheap uniform who'd stood silent while Caldwell knocked Katie's lunch tray to the floor. Marcus was looking at him the way a sniper looks at a target that just became visible. "Your badge and access card, sir," Marcus said. His voice was quiet. Professional. The kind of quiet that came from men who'd seen things that made hospital politics look like a child's game. Caldwell reached for his badge. His fingers fumbled the lanyard. Marcus took it gently, professionally, the way you'd take something fragile from someone unstable. Then Caldwell walked. He had to walk through the lobby, past the commander sitting upright in a wheelchair, stable now, recovering, his hand resting on something small and tarnished that caught the fluorescent light, past staff members who'd worked with him for years and now wouldn't meet his eyes, past the television screen still showing Katie's service record and her decorations, past the news cameras that were broadcasting his exit to everyone in Savannah who'd been awake at 7:43 a.m. The glass door slid open. He stepped into morning that felt colder than it had any right to be. He never came back. But that wasn't the ending. That was just the ending for Caldwell. The story, the real story, was still being written. Katie Morrison stood in the St. Michael's main entrance at 9:15 a.m., and the hallway full of staff and patients went absolutely silent. She was in dress uniform for the first time anyone in this hospital had seen her, navy white so crisp they could cut glass, her jacket heavy with the weight of medals that told stories nobody in this room could fully comprehend. The navy cross hung at her chest, the ribbon's colors, white and blue stripes, red at the edges, catching the light like a beacon. Below it, bronze star, silver star, 2 purple hearts stacked like evidence. Her insignia read Master Chief Petty Officer. The rank transformed her. The woman who'd been pushing a mop head through a hallway 3 weeks ago was suddenly someone different, someone whose presence made the fluorescent light seem dim by comparison. The Admiral stood beside her, extending a folder of reinstatement paperwork, not just her job back, but a full restoration of rank and status, along with commendation letters from the Secretary of the Navy herself and the Judge Advocate General for her work on the NCIS investigation. The fraudulent billing scheme had cracked open to reveal systemic failure across military medical contracts nationwide. Caldwell's termination was a single domino in a much larger collapse. But Katie walked past the Admiral. She walked past the assembled staff, past the photographers, past the NCIS agents still documenting evidence in the administrative offices. She walked straight to the ICU on the 3rd floor where the commander was sitting up in bed, his fur still running, his color returning like someone learning to be alive again. She stopped in the doorway. The commander saw her and his eyes filled with something that might have been recognition, might have been gratitude, might have been the understanding that he'd been alive twice now and both times it was because of her. He extended his hand. Resting in his palm was a tarnished military challenge coin, the kind made from aircraft wreckage and shrapnel, the kind that weighs more than its metal should allow. The unit insignia stamped into its face was from a field hospital in Kandahar. 2017, I believe this belongs to you, Master Chief, the commander said. His voice was steady now. Not yet strong, but steady. She took the coin. The weight of it was exactly what she remembered. You earned it, Commander. Kandahar, 7 years ago. You were the 14th life that night. His eyes widened. I was unconscious. Exactly, Katie said. You've saved my life twice, the commander said. The second time was hours ago in the trauma bay. The first time was in the dark, when she was running on muscle memory and prayer. Just doing my job, sir. The commander stood slowly, moving like a man relearning his own body, and came to attention despite his injuries. His hand rose in a salute that, while not perfect, held the weight of military ritual. Katie returned it crisply. The hallway full of staff and patients watched in absolute silence. When her hand came down, she reached inside her dress jacket and withdrew a small leather pouch. From it, she withdrew the challenge coin. She held it for a moment, 7 years' worth of weight, 1 night in a field hospital, 14 lives, a secret carried across continents and cover identities and undercover investigations that had cost her name and rank and the right to be seen. Then she pinned it back inside her jacket, where it belonged. The hospital administrator approached slowly, carefully, the way you approach someone you've already hurt. Master Chief Morrison, we would be honored if you would consider returning to St. Michael's in whatever capacity you choose. We're establishing a new veterans care program and we believe your expertise. Katie raised a single hand. The gesture silenced him. I'll think about it, she said. But her eyes moved past him, across the assembled hallway. To Marcus, still in his security uniform, still standing at attention, his own eyes bright with the recognition of someone who'd just realized they'd been standing next to a Master Chief the whole time. To the combat medic from the appendectomy, watching from his wheelchair, his expression saying 1,000 things he couldn't speak aloud. To 3 other staff members wearing small veteran pins she'd never noticed before, tiny brass insignia on their lanyards, their uniforms, their identities. The quietest people in the room. The ones nobody sees. The ones holding it all together. She turned to the Admiral, request permission to remain in Savannah, sir. I think there's still work to do here. He nodded. Granted, Master Chief. Looks like you already have a team. The final shot belonged to the future. Katie returned to St. Michael's not as a civilian nurse, but as the medical liaison for military operations, a position created specifically for her. She sat at the head of the first meeting of the hospital's new Military Medicine Oversight Committee, wearing scrubs with her rank insignia visible for the first time. Marcus sat at the table. The combat medic sat at the table. 3 veteran staff members sat at the table. And there, in the center, resting in plain sight where everyone could see it, was the tarnished challenge coin from Kandahar, the one that had traveled through 7 years and trauma bays and undercover investigations to find its way home. If you've ever felt underestimated by someone in power, if you've ever known something about yourself that the world couldn't see, if you've ever watched someone abuse their position and wondered when the cost would finally come due, share your story in the comments. And if you know of workplace misconduct, workplace abuse, or institutional corruption happening right now, report it. Call the appropriate authorities. Contact your state medical board, your federal investigators, your legal representatives. The quietest person in the room might be holding it all together, but they can't do it alone. Like this video if you believe in accountability. Subscribe for more stories of people who refuse to be broken by the system. And comment, what would you have done in Katie's position?